Hello, and welcome to the 16th day of One Health Awareness Month, One Health, One Welfare, One Planet. So today I'm going to talk to the folks that are in leadership roles, municipalities, maybe you work for a nonprofit or a non-governmental organization, an NGO, that does maybe emergency response, especially infectious disease. That's who I'm going to focus on, but however, folks, we're all part of a community, and I do have a message at the end, so stay tuned. Don't tune me out just yet. It's just gonna be my focus is a little bit today is in regarding the 16th day of One Health, One Welfare, One Planet. I'm just focusing a little bit on leadership, those that are maybe in leadership positions. So keep in mind that the One Health philosophy, and I call it the One Health Triad, looks at the collaboration of human health, veterinary, medical, and environmental sciences. And that is a huge, I say as a triad, oh, it's those three areas, but that's a huge swath of people. Because we're not just talking about MDs, DOs, we're not just talking about DVMs, we're not just talking about people that have, that are climatologists. It's anyone that collects data for any of those. It's the credentialed veterinary technicians, veterinary assistants, CNAs, nurses. I mean, it's anybody that falls under those blankets, and it's actually a pretty huge area. So I hope by now I've been tagging in my videos the One Health Commission, and I really hope you've taken an opportunity to look them up on Facebook. That organization has thousands of members globally, and they're a wonderful conduit for the One Health philosophy. So they encouraged communication between all these different professions and all over the world, collaboration. They encourage education. They have different webinars and various types of resources to help us all stay on the topic, because I have to tell you, this is constantly evolving. If it was stagnant, there'd be a problem. Because it develops at the pace that the world develops. So if you think about that, there's new diseases coming out all the time. We are, as people, function differently all the time. Our travel changes, how the role the animals play in our lives change, and laws change. I mean, my gosh. So because of all that, it's something I'm always reading and always trying to stay up on myself. And the One Health Commission is a wonderful source to do that. It is definitely a great place to turn to. They actually have a website and the Facebook page, and I will not just be posting or tagging them in Facebook like I have been up here. I'm actually going to have the link to them as well as to their website address, and I hope that you take advantage of learning more about them. And the calendar that I've been using has been from the One Health Commission. It's what they recommend for the topics for every day through the One Health Awareness Month. So for a second, I want to talk about them. Besides what I just explained of hopefully are reasons why you'd like to learn more about One Health and use them as a source. But there is this paper. Now this is a 7-page paper. I'm not going to read it, but the link's up here. Okay, I highly recommend it you do. It's very interesting. There was this paper introduced the executive director, Cheryl Stroud, and also talked to the chair of board of directors, Joanne Lindenmayer. And they talk about the purpose of the One Health Commission and One Health. You know, what is this? So there's one part that I do want to hit on because this will help tell you how broad this is, and that the last thing to me that we want to do is eliminate anybody out of the picture, because we all have something to contribute. And like I said, community members, if you're not in leadership roles, that's okay, because I have a message for you at the end too. So it says there are many definitions of One Health in use today, but all share the following features. They are rooted in a deep understanding of the interdependence of the 5 kingdoms of life, so bacteria, fungi, protista, plants, and animals, and their collective dependence on the plant's natural resources. They all recognize that the current state of life as we know it is not sustainable, and that many complex global health problems have been caused or exacerbated by human activities. they maintain that addressing these complex problems will require the engagement of a variety of experts and community representatives in a collaborative, interdisciplinary approach for which the solutions are greater than a sum of individual contributions. The One Health approach requires implementation on local, regional, national, and international levels. The outcome of a One Health approach is optimal health for its living inhabitants and the planet itself. So it's really important to me, the core of everything One Health is this. We all have something to contribute. That's the core of it. We are not saying that the planet is going to continue to thrive on one profession or one group of people because everybody has something to contribute to it. You know, I made a comment that if you're someone, let's say, that travels frequently, especially if you're traveling outside the United States, right? And I had commented about one thing you can do is make sure that you adhere to TSA regulations about what you're bringing back into the United States. So we have an activity that seems very simple. It's an activity that we think of, well, I don't do anything when I visit those places. You know, I stick to paths that are designated. I don't do much with animals. I do a lot of shopping. But I can give you an example of something that has popped up as concerns, or some products that you purchase that are made of animal hides that you think of, well, it's tanned. It's not a living animal. It's the skin of it, and it's been tanned. The process should kill it, right? Not necessarily. And there have been diseases that have been brought back into not just the United States, but other countries as a result of those animal skin products. So there's a reason why that these laws and these rules are in place. So our part as a community member is that when we travel, that we abide by that, because what we don't want to do is introduce a disease into our own country, right? So that collaboration is very important. It's that understanding that we all have something to give. So let's talk about what it would mean, examples of that it could be detrimental if we didn't collaborate. So let's say we have a community where a pediatrician is noticing cases of measles, and he or she is noticing clusters. Maybe they've had 3 or 5 patients or less of children that they are diagnosing with measles. What if they kept that information to themselves? What if they didn't give any of that information to anybody? What would happen? Okay, now let's talk about a veterinarian who maybe they're noticing they're having groups of dogs that they are diagnosing as having leptospirosis. Now, leptospirosis is zoonotic. It's a disease that can be transmitted from animals to people, and it's a bacteria, okay? So they're noticing, they're diagnosing these dogs. There's a cluster of dogs that have become positive with leptospirosis. What if they didn't report it? So we have a pediatrician that if they didn't follow reporting laws and did not report that, then you could definitely be helping to inflame a outbreak that may already be present, right? If you're a veterinarian that you have leptospirosis that you're not reporting, cases of leptospirosis, what does that mean? Well, with some illnesses especially, we look to our pets to see what the rate is that they have them. And we refer to this as a sentinel animal. So we don't necessarily have any people coming down with an illness, but all of a sudden we have pets that are. Well, if that pet is susceptible to the same disease we are, then that should be a definite red flag. For instance, lepto, it can be transmitted through contaminated water. So is there a water source that's contaminated? Is that a problem? Or maybe there's a swimming source, because there have been cases documented with that as well. Maybe there's a swimming source of contaminated water, of a body of water, that now the dogs are the sentinel animals. Just because we haven't necessarily had any human reported cases yet, the dogs that's the sentinel. That's what we're seeing, is that, okay, we have a concern here. So it's important that we collaborate. But why wait till after disease has already occurred? Why would we wait till only after the point that the fire is burning, but now we're not going to do anything? Or now we're going to do something? We should be focusing on doing something beforehand. We should be working and collaborating together, seeing the worth and value of each other, seeing how we contribute where everything fits before something happens, than waiting to see if and when some outbreak or something's going to occur. And as I said, it is more detrimental today than it ever has been. And the big thing has to do with travel. Because I can go anywhere in the world. That's how we've been able to somewhat keep disease contained to certain locales in the past, because either it wasn't accessible by travel, okay, it was very difficult, or maybe it was out of financial reach for many people, or people were not too enticed about getting on a ship for 6 months to get to wherever they needed to go. So it kept disease somewhat localized. Not always the case, but somewhat localized. We don't have that today. I don't have to be wealthy to travel to the other side of the planet. I can get on a plane right now. I can look online and make a reservation. I can get an airline ticket and everything right now to go anywhere in the world just about. Well, that also means that I could pick up something, or I could be taking something to them too. I could have something in me I don't know about, and I'm transplanting a disease somewhere else. So it's imperative we all work together. Okay, so I'm going to give a suggestion here for how we can do that. There is this manual that was put together by a collaborative effort between the FAO, okay, that's the Food and Agriculture Organization of the United Nations, by the World Organization for Animal Health, or the OIE, and the WHO, so the World Health Organization. I'm going to leave this up here for just a second. So I had read this last year. This was put out last year. And this was to really address zoonotic diseases with the underlying, using the underlying system of One Health. Okay, working on that collaboration. So this manual does an absolutely wonderful job of breaking down how to really collaborate and work with different entities and different groups and different people, different professions within a community. So this is helpful if you're a municipality. It's helpful if you are an NGO, that you're trying to be a conduit or trying to be the figure to bring collaboration or encourage collaboration together within your community. It walks through everything you need to do to create a One Health foundational plan, so in case something does happen. So it's either to prevent disease transmission or an event, or what to do in case one exists. So the entire manual is actually not that big. It's very succinct, and it covers everything you need to do to get started. But I will tell you, it's less than 160 pages. It's a very quick read. I'm just going to tell you the titles for the chapters. I'm not going to go into detail about it, other than there is a part I do want to read, as it especially centers with today being One Health, One Welfare, One Planet. It definitely feeds into that. So we have chapter 1's background, 2 is about the guide, 3 is a multi-sectoral One Health coordination, 4 is understanding national context and priorities, 5 is taking a multi-sectoral One Health approach to specific technical activities. Number 6 is monitoring and evaluating implementation of a tripartite zoonosis guide in the implementation. And then 7, of course, like glossary and references and so on. So it covers everything you need to do right through the manual. So why would something be like this be important? So when I had read this, it made me think of something, and it's something called ICS, an Incident Command System. Now, keep in mind that when I've said this before, so if it's redundant, you're not going to be surprised to have me say it again. So, I was deployed to Iowa. I was deployed to Iowa during the 2014-15 outbreak of highly pathogenic avian influenza. When it comes to having multiple sectors that contribute or respond to something that large. Now that was gigantic. That covered more than 20 states, and of course we're talking about that involvement was from organizations and small municipalities, up to, of course, I worked for the federal government, up to the federal government. Why is it important to have a plan like this? Well, look at that case. Everyone's protecting their own interests. Now I don't mean that in a negative way. I don't mean it in a negative way at all, because let me take a step back here for a minute. a municipality, if we're talking about a small municipality like a city, if there was a disease outbreak, of course, they're concerned with treating the patients that they have, right? That is their community, making sure the community members are treated, but also that it doesn't spread beyond the boundaries of their community. A state level would be looking at that additionally, that it doesn't spread beyond those community boundaries into the rest of their state. A federal government, you're talking about the concern of that it's not something that spreads federally. Now, when you're talking about each of those, then it's whatever agencies that fall under those umbrellas and those interests. So it's not looking at their interests in a negative way. It's that everyone wants to, of course, they have their own communities, their own agencies that they need to protect and enact. So when you use something like an ICS, an Incident Command System, you're saying, hey, we understand all of you have something to contribute. We understand all of you want to protect your interests, so we're going to put everyone on an even playing field. Okay, that's how the Incident Command System works. This, to me, is what it made me think of. Because you're trying to bring everybody together to the table. You're acknowledging the fact that everybody has something to contribute. And you're seeing how everyone fits in those as puzzle pieces. Because what we don't want to do is wait until there is an outbreak. What we would like to do is possibly save human and animal lives. We'd like to prevent the aftermath of having to worry about a disease outbreak, right? And not to mention, look at the amount of money it costs for us to go into to treat it as opposed to prevent it. So this One Health foundational approach that was put out by the wonderful organizations, the OIE, FAO, and the WHO, is a great start to get community members involved with making their own plan, no matter how small you are or how big you are, because this is even promoted and has been used on a country level. Okay, so there is one thing I do want to read out of here, and to me this really sums up the benefit of doing this, and it's actually on page 4 of the manual. So it says the benefits of an effectively implemented multi-sectoral One Health approach for zoonotic diseases. So what are the benefits? The response to zoonotic disease events and emergencies is more timely and effective. All sectors have information they need. Decisions are based on accurate and shared assessments of the situation. Accountability to each other and to decision makers ensures actions by all sectors. Regulations, policies, and guidelines are realistic, acceptable, and implementable by all sectors. All sectors understand their specific roles and responsibilities in the collaboration. Technical, human, and financial resources are effectively used and are equitable. Gaps in infrastructure, capacity, and information are identified and filled. Advocacy for funds, policy, and programs is more effective. You know, the old adage about safety in numbers definitely applies with this too. Because you're talking about that we're all benefiting from that same pie. You know, we're all benefiting from the funding, the knowledge, which is huge, the resources. We're all benefiting from it as opposed to being lopsided and expecting one area or one group or one government to take over everything. Because, you know, in the case of HPAI, or highly pathogenic avian influenza, the federal government, of course, helped get everything under control. But there was so many needs on so many different levels, and I didn't even realize. I have had training in person and online, but that was, I'd say, the largest incident that I had been part of seeing all the different agencies and the entities that are involved. For instance, because of the jobs that were lost, entire facilities were decimated. Facilities that have hundreds of thousands of birds now had 0. So all the jobs that were from that were lost, not only at facility, but it affected the feed stores that delivered to those types of facilities, or transporters that either brought animals there or maybe brought the feed, or, I mean, it was just huge. And then you're talking about the individual communities that were built up around those poultry processing facilities. Okay, so in Michigan, It's just give a little bit of a parallel. We have many communities that are built up around the auto industry. And one of our concerns in Michigan was with the auto industry goes under because we kind of created a monoculture for a while that everything was surrounded by the auto industry. Then the concern was if something happens, of course, all the other industries that fall under it, not just that are auto or plant related, but the restaurants and the other businesses that have built up around those places. What would happen to them? Well, this is what happened in Iowa, for instance, and I can speak of this because I had talked to the emergency managers that were dealing with the aftermath. The people lost their jobs, which meant the restaurants and the other businesses shopping in those communities and those small communities were also affected. Of course, when you're talking about a rural community, it's not like, well, I'll just go out and get another job. It's much more complicated than that. People were going without food. So emergency managers had to look at bringing in mobile food pantries to assist the families that now had lost their job. So when you think about the amount of involvement that it would need to do that, this is exactly why it's an important thing to try to bring collaborative effort before something happens. Why not do something, a manual or some formal form that really lays out what resources are available, who can you lean on for what, so that if and when the time comes, you're able to address those needs, which means you're better professionals to the people within your community. Okay? So, I highly recommend this, a tripartite guide to addressing zoonotic diseases in countries, and this is taking a multi-sectoral One Health approach. I will have the link right up here so that you're able to read it for yourself and download it. That's how I did it. The organizations allow you to download it for no price, no fee, no cost to do this. To download it at no price, no cost to you. So I've hit on One Health, One Welfare, One Planet, and I primarily focused, of course, on leadership and what we can do as professionals within our community. But now I want to address the people that are everyone else. Okay, and this also includes us professionals too. Anyone else within a community, which everyone should be going, that's me. Everyone's in a community somewhere, right? I am a huge professional advocate of taking the philosophy of see something, say something. Okay? And if we're really looking at it, One Health, One Welfare, One Planet, each of us have a stake and each of us have a responsibility to say something. So what I mean by that is if you have, let's say you have a backyard bird flock, 3, 4, 5, 6 chickens, and all of a sudden they're perfectly healthy, you never had an issue with them whatsoever, and you wake up one morning and you go out to the coop and all but one are dead, or all of them are dead, and there's no obvious reason. You're not seeing any predator had gotten into them. You're not seeing anything that would signal to you that something has happened, and you had not seen anything, especially if you had not seen anything with their health before. Then you need to contact your agriculture department for your state. Because what happens is in a situation like that, let's say it was avian influenza, that can be transmitted on fur, feet, and feathers of other animals. So for instance, if you have mice that run through there and they go to another, either a poultry facility or maybe it's your next door neighbor who has chickens too, they can carry that virus on their feet or their fur. Or maybe you have birds, and how common is this? You have birds, chickadees, that fly in and eat out of the same feeder as your birds do, right? As your chickens. Well, we're not as concerned because with songbirds, avian influenza doesn't typically affect them. But we are concerned about their feet and feathers and them transmitting that virus somewhere else, taking it with them. So when we see something that doesn't make sense, and especially if we can't explain it, like these birds were perfectly healthy, then we need to take the opportunity and be aware of the fact that what's happening with me could affect someone else within my community, and I'm going to report it. Okay, so each of us have a stake in this. Each of us have an opportunity that it's not just, those that are part of the One Health professions or the public health professions, but it's also as a community member that when we see something that doesn't quite make sense, excuse me, that we report it to the officials so that professionals can look at it and assess and determine whether this is a concern. Because I can tell you, especially with the example that I gave with poultry, if it turns out and you call the state and it turns out maybe it was some upper respiratory that went through, or maybe it was a predator, maybe you just couldn't see that word symptoms, but signs, but it turned out it was, trust me on this one, they will be incredibly relieved. They will not be upset. You will not be penalized. They will be breathing a sigh of relief. Thank God it's not anything we have to deploy or implement anything. You will not be penalized. And I don't care what state you're in, you do not have to be concerned with this. But it's better for you to take the initiative and to contact somebody and to be on the safe side than possibly affect maybe livelihoods that could be in your community, or other backyard poultry owners that could be your neighbors, within your community. So this has been a wonderful, I believe, a fantastic topic to cover in One Health. So One Health, One Welfare, One Planet. I will see you tomorrow for the 17th day. Don't forget to check out all the links up here. You'll see one for the manual. You will also see one for this awesome interview that was done about the One Health Commission. Please check out the One Health Commission. Whether you're in a profession or not, doesn't matter. They have wonderful information. You can check them out on Facebook or their website, and again, that's up here. But please, folks, don't forget about down here. Your questions, comments, anything that you want to throw out there. Let's keep the conversation going. I'm hoping that One Health Awareness with us, my video, my official videos might end, as of January 31st. But I hope our conversation continues. I'm hoping that we continue the conversation and that we make our communities as healthy as we possibly can. Thanks, everybody. Have a wonderful day.